My name is Peggy Perkins. I work for South Bay Health and Insurance Services, and I'm a health insurance agent, and I specialize in Medicare products. Before I became a health insurance agent with South Bay, I actually was a special ed teacher for 14 years. But one of the greatest gifts that I was able to walk away with was patience and gratitude, and most of all, just being able to listen to the wants and needs of an individual. But after those 14 years, I decided to just take a turn in my life and started, working in Medicare sales. One of the things while working in the special needs community or with my students was constant advocacy and making sure that their voice was being heard in some way, somehow. After stopping my educational career in special needs, I took a lot of those traits into the Medicare field, because when you're dealing with Medicare patients in the senior community, a lot of the times their voice isn't heard. So when you have a powerful agent that's able to advocate and magnify their complaints to the correct people, you have an agent that's not only advocating for them, but at the same time is making sure that their voice is being heard. And that's definitely one of the biggest skills that I took away as being a special ed teacher into the Medicare field. How has SBHIS changed my life? Well, if you know anything about education, teachers don't make that much. I've been able to put tons of money away from my savings. I already have an exit plan, strategy planned out. That definitely wouldn't have been something that I could have done as a teacher. Being able to pay for my son, who's going to be going to college soon, being able to pay for his education and not having to worry about having to take out a student loan. That wouldn't have been something that I would have dreamed about 10 years ago. That just wouldn't have been in my realm. But ever since I transitioned, doors have opened immensely. And just being able to know that I can continue along that path and that there's no end towards it, it's exciting, especially with the way Medicare it's headed towards. So I'm looking forward to the tomorrow and the unknowns of what the future holds. The big takeaway for me is I am a social butterfly, so that portion came to me very naturally. I love being outdoors more than I do indoors, so me going and meeting complete strangers, as odd as it sounds, to me it's like I don't see it as meeting a stranger but making a new friend. And when you make a new friend, you can leave an impact, and when you know that you've helped that person tremendously, whether it was financial through helping them reduce the cost of prescription or relieving some of that stress from them not knowing how to maneuver Medicare, all of those things, to me, I just go, I've left an impact. I've helped some way, somehow. And when you're able to do that in a different type of a setting, especially when it's not an education, you walk away feeling a little bit, with your head held high and your shoulders kind of pushed back a little bit, because you did it from the heart. You didn't do it because you knew that there was a payoff at the end. You did it because you truly from the heart wanted to serve, and you wanted to do it to the best of the ability that you have. And that's what I strive for on a daily basis when I meet someone. And that's why I think I've been so successful, because I do it because I want to help. And when you do it out of your heart, it shows and it comes across. For me, being a health plan specialist means meeting people that you definitely never would have met, because most of my business is just based on referral. It means serving with your heart, knowing that you truly are making a difference in someone's life. Whether it just might be from helping them apply for a certain low-income subsidy, or helping them apply for their Medicare Part B portion, or helping them find a new doctor. Anything of those little things, those all help along the way, because even though it's not my journey and I'm just there as a small portion in helping that member in their Medicare journey, at least I was one part of that, significant part of that journey. So that part I take with me on a daily basis. It's a little honor badge that I get to walk around with. Because of the pandemic recently that we had, I had a client who called me and had told me that her husband had passed. And both of them and they're still very close to me. She didn't get to say goodbye to her husband because he had passed away in the hospital. And the day of his funeral, she couldn't go because she had COVID also. And all of her family is from New York. And as you know, New York got hit really bad as well. So I asked myself, what would I want to do? So I put on my gloves, I put on a face mask, I showed up to her driveway, and I called her, And I said, you need to come outside. You're gonna get in your car. I'm gonna be behind you. And we're gonna say goodbye to Bob. And that's what we did. She got in her car. I was behind mine. She rolled down the window and we got to say goodbye to Bob together. But she needed that more than I did. And even though it wasn't closure for me, I just knew she didn't have anyone to help her. And not to say that I was the part that helped her get across, I was just the one that pushed her along the way. And to this very day, that's probably the one that I hold closest to my heart. Because I know that she thanked me profusely afterwards, because I know she wasn't going to do it, but I know she didn't get to say goodbye the way she would have wanted to. And having her at least say goodbye that way, she had some closure. I wasn't her agent that day. I was her friend. And that is what divides and separates the super agents from regular agents.